Thanks to the Liberals, Canada will be the first jurisdiction in the world to put warning labels on ground beef and pork. Imposing these warning labels means a single ingredient, wholesome protein that most Canadian families rely on will be unaffordable. How nonsensical is this? They are putting a warning label despite the fact once this food is cooked, it does not exceed the Liberals' self-imposed limit on saturated fats. So, how many doctors raised concerns with Health Canada that too many Canadians were eating raw beef and pork that warranted these ridiculous and unwarranted warning labels that are punishing Canadian farmers and consumers?
The Honourable Parliamentary Secretary to the Minister of Health.
Unlike my colleague opposite, we are concerned about the rising rates of chronic diseases in Canada, and last week being Men's Health Week, where we talked about in this House how a disproportionately high number of men are dying from chronic diseases. I think we can all agree that more information at the grocery store is a good thing. 2 in 5 adults currently report having at least one of the 10 most common chronic disease, Mr. Speaker, and that is unacceptable. These labels are widely recognized by health organizations and the scientific community as an effective tool to help counteract the rising rates of diet-related chronic illness. Mr. Speaker, on this side of the House, we agree that more information is always a good thing. Thank you, Mr. Speaker.
Member for Bow River. Mr. Speaker, many of my constituents are aghast and angry that Health Canada chose to attack healthy, nutritious, protein and iron-rich food products like ground beef and pork with a warning label. And added labeling costs to the industry we pass down to the consumers. But Health Canada doesn't seem to care about increased costs. Health Canada should be concerned with keeping Canadians healthy, not adding to the grocery bills. Will the minister ensure Health Canada drops this damaging, expensive, unnecessary, ideological-driven warning label? Parliamentary Secretary.
Speaker, on this side of the House, we will always prioritize Canadians' health based on scientific evidence. These labels are widely recognized as a good tool to support Canadians as they make good decisions at the grocery store. Mr. Speaker, let me be clear. Canadians will still produce and purchase ground meat. However, they now have a choice to make and an informed decision to limit their saturated fat consumption. Our government is committed to protecting the health of Canadians, to continue our work in the food industry to further reduce sodium and fats in the foods they purchase. Thank you, Mr. Speaker.
The Honourable Member for Prince George, Peace River, Northern Rockies.
Mr. Speaker, I was in Inuvik, Northwest Territories last week where 2 liters of orange juice is $21.20. A box of Kraft Dinner is $3.09. Wow. Ground beef is almost $20 a kilogram. Wow. A 2-pack of ketchup is $24. Regular fuel is $2.60 a litre, and residents' gas bills are over $1,000 a month. When will this government wake up that its high inflation, high taxation is making living in the North almost impossible?
The Honourable Minister.
I thank the member for that very important question. All Canadians, regardless of where they live, should have access to affordable and nutritious food, and that's why in Budget 21 we expanded Nutrition North with $170 million in funding and collaboration with Indigenous partners to address food insecurity in the North. To offset the financial burden caused by COVID, we also announced $25 million in support for Nutrition North, Mr. Speaker. We realize there's a lot of work that we have to do, but we feel we are going in the right direction.
We are.